Your doctor has recommended an induction of labor. We want to provide you realistic expectations for this process and remind you that we're all a team and partnering with you to provide the safest birth experience. The decision on induction may happen for a number of reasons, but can usually be broken down into degrees of acuity. The first may represent a reason where your health or the baby's health is at risk. These patients are obviously higher risk, and the induction process may need to be expedited. For our lower risk patients, we are also aware that the body can naturally labor with encouragement, and thus may take several days of monitoring the changes after each intervention. For scheduling, the surgery scheduling office manages all the inductions at the request of the primary obstetrical provider. Some days the hospital may limit inductions because of the activity on the labor floor. Our practice is also only permitted a certain number of inductions per day. This means that it's very possible you may, for example, be scheduled at 7:30 a.m. for admission, but this needs to be changed up to the last minute. It is also possible that elective non-medically indicated inductions may need to be moved to a different day. So be flexible. It's your baby and it's going to arrive when it's safest and you can get the most attentive care. Please know that we do our best to advocate for our patients, but we also try to avoid the most highly scheduled times to minimize disruption. The hospital also does not release induction dates until 7 days in advance. Prior to coming in, get a good night's sleep the day before. Have a healthy breakfast and review any medications you are taking with your primary doctor. Most all medications will be recommended to be continued as usual. Prior to leaving your home, you should call the labor floor 617-732-4805 and ask about last-minute delays. This will prevent you from waiting in the lobby for extended periods of time. Also plan to valet park your car. It is the least expensive way to park at the hospital. It also makes it easy to retrieve baby bags if you need to. When you check in at the admitting office on the first floor, you will be brought to the desk on labor and delivery to await your room assignment. Initially, we recommend you bring one support person. Triage only permits one person as the rooms are small and we must be cautious about privacy. Once admitted to a labor room, you may have additional support people after you have reviewed your care with your providers. I remind people that birth is not a spectator sport. We want those people who you need for your labor and who are staying with you the entire time. The labor floor is locked for its privacy and protection of our babies, and all of our patients and visitors must check in with security. Know also that if someone calls the unit, we will not provide any information and we will ask them to directly contact you. There are several medications and processes for induction. I would like to review the most common things you might experience if your physician recommends induction. Cervical ripening. The cervix is like a bagel, and we score the cervix, which is called the Bishop's score, based on several things: softness, thinness, station, dilation, and position of the cervix. A cervix that is favorable will allow the induction to proceed with the safest of outcomes. About 30% of women will go into labor within 24 hours of receiving ripening, and this may be the only medication necessary. It can also be given over several days, a process we refer to as a slow roll. Prostaglandin medications are naturally occurring substances that are prepared biochemically. These medications have different delivery methods. The most common is misoprostol, which is a tablet given orally or vaginally. A monitor is performed prior to the first dose, and then 1 hour of fetal monitoring to track the baby's heartbeat is required after. Depending on the clinical situation, you may be sent home or walking for several hours, or asked to remain at the hospital on the monitor. The timing of the subsequent doses cannot be given more frequently than every 4 hours, and no more than 6 doses can be given in 24 hours. Often this can be done over several days. Cervidil is a prostaglandin insert the size of a postage stamp that remains in the vagina for up to 12 hours. It requires continuous monitoring, and patients who receive this are often patients who cannot ambulate and must remain in the hospital. A good example will be someone with high blood pressure requiring rest. Mechanical ripening is done with balloons. Ripening balloons are catheters that have a small balloon that can be inflated to help stretch the cervix. They are called a Cook balloon or a Foley catheter. After placement, patients can either ambulate for up to 12 hours, or at times additional medication such as misoprostol or Pitocin can be given. Balloons are placed during a pelvic exam and sometimes require a speculum similar to a pap smear. The balloon is filled with a small amount of water to place pressure and mechanically stretch the cervix. Dilapan is a small rod similar in shape to a short cigarette, and this is also placed into the cervix. It can be left there for a period of time to absorb water and thicken to stretch the cervix open. It stretches very slowly and can be left in place for up to 24 hours. Pitocin induction is most commonly used for patients who either have a ripe and ready cervix or other medications are contraindicated based on their history, such as a prior cesarean section. This requires admission to the labor unit and continuous fetal monitoring while on the intravenous medication. However, sometimes the medication is used only to get the body started, and other things such as breaking the water can help the natural process kick in. The fetal monitor checks the baby's reaction and also allows us to tell the frequency of the contractions. There are strict hospital guidelines based on your clinical history, but often this is a very slow process. There is no set time for inductions, and women can take many hours before even feeling the first contraction. Everyone is different, and our goal is to work to get the most natural yet efficient process. Once the labor is started, the Pitocin may no longer be necessary and can even be turned off. We want this to be the best experience of your lives. Please let us know as we partner with you so that you can feel empowered to be an equal member of the team caring for you. Always share your concerns with your team. Remember, we have been to thousands of births. This may be only your first. Our advice is only meant to be safe and provide the healthiest outcomes for mother and baby. I often say, each time we see you, it is truly a game day decision. Things change, sometimes by the hour or even by the minute, just like the weather in Boston. Zen is the word, and this will help everyone on the team care for you and your baby.